Hey guys, it's Dr. Emer. We are doing another Aerify tonight. I'm really excited with Shawnee. She's one of our amazing medical camouflage tattoo artists. I'm super excited for her. Hi, Lissa. Hi, guys. I know it's Pride and everybody's out and they're enjoying themselves. I'm just really excited to be doing this sort of spa Sunday. We're gonna get Shawnee on right now. We're gonna do Aerify tonight. She's never done it before. She practiced a few times a week, and she's doing medical tattooing. You guys are going crazy over this, and I'm really excited to introduce her to you. We're trying to get her on the live. She's gonna do Aerify, and you guys know my kit has in it some of the most amazing products from EMERAGE Skin. Hey guys, hi Tommy, hi Scorpio. I'm at home too. And inside the kit is our mask. There she is.
Hi.
Hey. Come in close. Show everybody your skin. Tell everybody who you are, okay?
Yes. So my name is Shawnee Ellsworth. I am a medical tattoo artist and international trainer.
International, you guys. Big time.
So my next international course is actually going to be in Montego Bay, Jamaica in August. So anybody that's out there that wants to get stretch marks or scar camo, I'll be there for a week. So you should come join me.
Tell them a little bit what that is. What is scar camo?
So scar camouflage is basically camouflaging the scars that you have from surgery or any type of accidents or anything like that. Typically for a hypo, which means white scars, we would match your skin color with ink and we pretty much camouflage it. If it's a dark...
Amazing if somebody has like surgeries and they have some scarring or discoloration, if they have, you know, a breast cancer and they're having to reconstruct their nipples. There's so many things, you guys. Just so you know, after the perfect derma peel, do Aerify within the week after. It is unbelievable if you do this Aerify every 2 weeks afterwards. So Shawnee will actually put the mask on tonight, and then she's going to follow the 2-week protocol. Tell everybody.
Where's your drink?
What are you drinking over there? I know. I'm drinking Snapple right now.
Snapple. Rosé.
I'm sorry. This is my peach schnapps Snapple.
Okay.
So I'm glad that you're enjoying yourself. Come in, you guys, anytime, and you can get any of those treatments that you're talking about on there. Tonight, I want to talk about Aerify. She just washed with the foaming polish. This is one of our #1 selling products. It has jojoba extract. It acts like an oil-based cleanser. It has licorice root in it to brighten the skin. It's anti-inflammatory. So tell me, what did you think of this?
It's very smooth. I love it. It's not drying. It's probably the jojoba that you were talking about. I love oils in general. So I love that it's in there. So it makes your skin super soft. Typically, I do have, well, it's kind of a combo. I do live on the beach, so it's like it's dry and oily at the same time, but this actually cleanses really, really well.
Everyone loves this. Thank you, guys. Thank you, Fab Obsessed. Craig, thank you. Toronto Boy wants to know if tattoos can cover a tummy tuck scar. Yes. We can also send you some peels that you can do at home first. Even my Aerify, right now we're testing on scars with microneedling and derma rolling. Lindsay says she loves White Claw as her drink of choice. So use this foaming polish. There's Jordan. Jordan, what's up? Jordan's going to apply Aerify tonight too, right?
Yes, let's do it.
All right, I can't wait. Are you drinking a White Claw or no?
I actually have a mango margarita that Shawnee gave me.
Oh, fantastic. So yeah, this is great. So you'll use this twice a day as your cleanser because this is anti-inflammatory. It's very hydrating. There's the mini size in the Aerify kit, you guys. You can get this all emeragecosmetics.com. You can also make a consultation there with our team for Shawnee, as well as any of our skincare people, which we love. Lindsay, of course, is there. They're asking if you do microblading for brows.
Yes, absolutely.
She does. Contact us, you guys. Now, in the kit is 2 main products, HYLA-A, which is a retinol and hyaluronic acid, And then High Spot, which is an anti-aging brightening cream. It has peptides in it, like the Refit Face that's in my EMERAGE skin line. It also has botanicals, mulberry extract, blueberry, which is anti-inflammatory, and green tea, which decreases puffiness around the eyes. So you're going to use High Spot twice a day.
Okay.
I love this product. The cleanser is not a PHA acid based. It is a water-based jojoba extract and licorice root. So it's not an enzyme or an acid. HYLA-A, you guys, is retinol. Everybody needs retinol. Do you use retinol?
I do.
So I love retinol. Brightens the skin, helps find wrinkles, tightens the skin. They're asking if you can mix them at the same time. You can. Just so you know, lots of studies have been done on mixing products and applying them. And if you put your serums on before your creams, before your ointments, and before your sunscreen, that's the perfect thing. But you can mix them, no problem, if they're of the same category. So you can mix all your serums, apply them at the same time, mix all your creams, apply them at the same time. And then the other thing that's in our kit, you guys, is Fusion Shield. This is my SPF. I love this product because it's a tinted SPF BB cream. It has vitamin C in it. It brightens the tone. It evens out the tone. And you can see here, it blends right in. So if you want to use this as a camouflage for dark circles, for blemishes, or just your SPF before you put your makeup on, it's perfect. You can use retinol twice a day. They're asking if you use retinol just at night. Most people use it at night because they don't want to be exposed to the sun and it makes them really sensitive. You see I'm red right now. I did Cosmelan last night, which is a stronger medical grade peel. You guys can get it at emeragecosmetics.com. But then I went out and did a hike today. I had sunscreen, but I'm still a little red. So that's because I had all that retinol. So what do you want to get out of this?
So, do you see I have a little bit of well, looks a little bit like hyperpigmentation. I just want more of that flawless skin that you have, Dr. Emer.
You know why? Because I do peels all the time and I do lasers. So I think this is a good starting point. I think if we see a really nice improvement here, we either do it more frequently, this peel, or we do something stronger and then we add in the peel. I think this should be done every 2 to 4 weeks at home. What we're testing right now is actually doing it weekly. Instead of taking the whole mask and putting it on, we're doing it weekly with derma rolling in one layer. And a lot of people are seeing really good results with that. Even if you're very sensitive, you guys, you're gonna have some reactivity to retinol. That always happens when you first start. So if you do, we back off a little bit and then we start less often and stuff. You do it less frequently. So maybe twice a week or once a week versus 3 times a week or every day.
Right.
So
I have a little bit of redness too. I'm not sure if it's the Asian glow because I've been drinking, but I have a little bit of redness right here.
That's okay. I like that. That's fine. The redness is no big deal. I just don't want you irritated. So some people on here are saying they do Aerify weekly, which you can. So why don't we do the mask? Show everybody what the mask looks like.
Okay. Here's the mask. So do I put the whole thing or do half or what do you suggest?
No, the whole thing. I want to do it the way we normally do it. If you want to leave just a teeny bit, we could do it for a booster in 1 week, but maybe just a pea size. The rest put on because we tested this out and it really needs to go full hairline, full face, everywhere. Push that all the way up.
Okay.
So you're going to put that, show everybody the mask because the mask itself, you guys, is a retinol base. So it's going to have a yellow-orange color. They said they used this product for the first time without any breakouts. That's great. How to use these products in the summertime. You can just use them in the summertime and cover with your sunscreen. There's also a product called Sunisdin at emeragecosmetics.com or HelioCare. Both of those protect you internally from the sun. They're really good, and I would suggest taking those as a supplement because that will help you protect your skin a little bit.
Okay.
And how does that feel?
Feels good. No tingly. It's not burning like other masks that I've used
like
before.
real like strong peels are going to have an inflammatory component, meaning they're going to kind of burn the surface. This is not going to do this. This is an
Right.
exfoliation peel. It has in it licorice root, arbutin for decreased inflammation, niacinamide that decreases redness, retinol, and then a little TCA and salicylic acid in there. So this shouldn't feel irritating. It should feel cooling. I want you to go all the way up here. And then what we'll do with you, different than we've done before, is we'll use about three-quarters of it, get it all on there. And then what we'll do is we'll do a little bit as a booster in a week.
Okay. Can I do my neck too?
So someone just wrote Aloe Metaesthetics, said I'm a physician and I have an aesthetics practice. I did this peel to try it out, alternated with microneedling. The result's amazing. Do me a favor, do it with your microneedling.
Okay.
Apply it right afterwards. Do it every couple weeks. You will love it. Or do derma rolling and apply a small amount. I'm just talking to this physician. They're also saying, Natalie's asking, what's the SPF ISDN? No, the SPF is Fusion Shield by EMERAGE Skin. You can get it at emeragecosmetics.com. But the supplement is called Sun ISDN, and it's on EMERAGE Cosmetics, a pill that you take. This does not have turmeric in it. Although turmeric is very anti-inflammatory, it doesn't have it in there.
Okay.
So what, did we use it all?
Yes, I have just a tiny bit left, but
Are you sure?
Oh.
You know, here's the thing, you guys. Get a little bit more out of there.
Is
more or no?
Here, squeeze.
So you guys, just so you know, retinol is considered unsafe in pregnancy, although I don't believe that retinol gets absorbed into the skin or the body.
Yeah, I have this much left.
Perfect. So
Jordan was able to get me some.
That's fine. Then save the rest. If there's any left over, we'll use it in a week.
Okay.
Order Aerify, you guys. Now, I use it with my micro-rolling system once a week. This has in it the human bone marrow stem cells from the Aerify ampule, and it has our 0.5 millimeter microneedle and 2 stem cell ampules for about 10 treatments. You can do this every week and apply Aerify right afterwards. It gives such a great result. You will love it, and it will make it penetrated more. But you can use microneedling. I do think you should get the micro roller kit and use this with your products. If you go into a skincare consult, we can give you the recommendations on what to do. Yes, you can use retinol if you're breastfeeding, and you could do Aerify if you're breastfeeding. So I'm really excited, Shawnee. I want to see results. I also really want people to know about your services, because what you do is so unique and cool. I think it's an amazing thing that helps so many people. You know, they have scars, they have marks that really bother them. How did you get into it?
Yeah, I mean, a lot of people don't know about it. That's why it's so crazy to me. But I started off microblading. Well, I was an esthetician first, and then I got into permanent makeup by just microblading and doing eyebrows. And then I got my first cancer survivor client as a brow client. But her reactions after I did her brows was completely different than the other clients that I've had. She started crying and stating that, I brought something back where she never knew that she could. And it was just, it was a different experience and feeling. So what I did was I'm like, you know what? I'm just going to take it further. I flew out to Penn Medicine. I'm in Pennsylvania, trained for areola repigmentation. And it kind of just snowballed and started doing scar camo, and then I got into stretch marks, and now I'm working with you, which is pretty
I love that, because I do lasers and other treatments. Sometimes they need that first, and then they do the needling, the microblading, or micro tattoo pigmentation. Sometimes they just go directly to you. And so I want everyone to learn about it, because it definitely is something that's an offering that can help so many people. What I would tell you, Lauren's asking, should retinol be used before microneedling? So if you're using the regular retinol, like the HYLA-A daily, this is at nighttime. You apply this at night with your other stem cell and growth factor products. I like Anti-Age, my Refit Face and Eye. I use a lot of other brighteners. You would use that product daily. But if you're going to micro roll at home, you can micro roll with the EMERAGE Skin Microneedling Kit and then apply the Aerify mask overnight. You can also even microneedle in retinol. There's something called DSC that we do in the office. So come call us, emeragecosmetics.com. Someone's saying, I want a derma roll tonight, but should I do it before my Aerify post products or should I not do it at all? Derma roll, babe. There's no problems with derma rolling. Just apply the Aerify mask on at the same time. No big deal. So yeah, so that's it. So I'm excited that people are going to learn about you. You're going to show them how great your skin's going to look. You're going to follow the EMERAGE skin protocol. Are you excited about it?
Super, super excited. Can't wait to show you guys my results. I took some before pictures today. And then we'll just continue and show you the progress. Super excited.
Excellent. So show them up close your face. Do this.
Oh, wait, let me bring that.
You got to go like this though. Ready? Look.
Oh, God.
Perfect. Got to do that. And then that's it. We'll end tonight. Jordan and Shawnee, you're going to both go like this. Perfect. Got it. You're going to show face, you know? And then keep us updated because people really are going to want to know. The EMERAGE Retinol is ready moisturizer to be applied. So just so you guys know, almost all the products have some level of moisture in them. High Spot has a anti-aging peptide serum inside of it, and HYLA-A has hyaluronic acid. So you don't really need it, but I always tell people add hyaluronic acid. We use EMERAGE Cosmetics HYLA-B. And then also I really like a couple other hydrating moisturizers, Sente Dermal Repair, Anti-Age MD Serum, Nude Skin, Vitamin C, Citrus Mask is amazing. All of those are at emeragecosmetics.com. Use them. Use EMERAGE Skin Refit Face and Eye. Those are high peptide products and growth factors. But otherwise, this kit alone will give you a transformation.
Perfect. So, and how long do I leave it on? Or
so 8 to 10 hours. I want you to have that on. Definitely put something behind you when you sleep so you don't get it all over the place. Okay. And then that's it. And then we just see you glow over the next couple weeks.
Sounds good. Thank you.
All right, you guys, tell them how to find you again.
Well, you can find me on Dr. Emer's website or www.exquisiteaesthetics.com. I'm also tagged on here, so just click on that link. You'll go to me, and that's how you find me.
All right, love you, babe.
Love you.
Great. All right, you guys, thanks again for following another Aerify. Shawnee, contact us, emeragecosmetics.com or appointments at jasonmrmd.com so we can get you booked with her because she's amazing.
Sounds good. Bye. You're amazing. Bye.